Good morning, and thank you for joining us for the March episode of Stop Diabetes Insight. I'm Beth Grant.
I'm Carol Dixon.
Good morning. We are just going to go ahead. We have lots of stuff coming up for all of our fundraising events and activities. Last month we talked about camp registration had opened. It is still open. About how many people have registered already?
We have about 60 campers.
That's great.
Registered so far, but we still have some openings, so there's still time to register. Do we have the website up for this?
I don't know. I don't think I have the website.
So
on there.
if you're interested in registering your child for camp is June 5th to the 11th this year, and registration is at diabetes.org/ADA Camp John Warvel, and Warvel is spelled WARVEL, where the easiest thing might be just to email me, Carol Dixon, at cdixon, DIXON, at diabetes.org.
Great. You can send all of the links and all of the information. We're just showing some pictures right there. And again, there's Carol's contact information. So if you have questions or would like that link emailed to you, she can go ahead and get that to you. No problem. Next up, Diabetes Alert Days, March 22nd. It's always the fourth Tuesday of the month. There are lots of activities that are going on with that. We'll delve into that a little bit deeper in just a second. Our Kiss a Pig event is April 12th, and we've talked about that in the past of what a great fun event it is. This year, we are very fortunate that we have a lot of former campers.
We do. We
have signed on as candidates, correct?
That's right, and they're representing their universities, so that's even more fun.
That's
so
really
not
fun.
only do we have camper to camper rival here, we also have university to university rivals going on here.
That's fantastic.
Yes, so it's going to be great fun.
Really good. Then May 4th is our mission day. It's Get Fit, Don't Sit Day. So we'll continue to, give you information about that. But, there are a lot of research out there right now saying that, sitting is the next smoking.
Right.
So sitting for more than 90 minutes is very harmful to your health. So on Get Fit, Don't Sit Day, we're encouraging people to every 90 minutes to get up and stretch, take a walk around the office, do walking meetings. And we do that too at the ADA. We really just try and get up and get out. Now the weather is starting to change, so it's becoming a little bit easier on us.
Right. And we have a whole toolkit available for people that want to participate in this day. So just contact our office and we'll be happy to share it.
Very nice. And then June 4th is our Tour de Cure event. It is at the Indianapolis Motor Speedway. Registration for that is open right now also, and that website is diabetes.org/Indy Tour. But again, if you have any questions, just email either Carol or myself, and we can get you the information really quick. And then camp will actually be June 5th through the 11th.
Right.
So then it will be walk season coming in August 27th, Step Out Walk. We are actually returning to the Canal area, the Celebration Plaza in downtown Indianapolis.
Beautiful
for this
area
event.
for a walk.
It's very nice. A lot of green area too, and
Right.
we usually have a lot of entertainment. We have a band or a DJ, so we encourage people to come out and walk and stick around. We'll have lots of vendors out there too.
Food.
Exactly. Food, lots of fun, and opportunities to not only just talk with us and get information about diabetes, but how can you be a part of any of these events. We're always looking for volunteers.
Absolutely. And this is a really nice way to honor people that have diabetes in your life, or perhaps you've had someone pass away because of diabetes. You can walk in their memory.
Very nice. Then, of course, November is American Diabetes Month. And we do a lot of education throughout that month. So as we get closer, we'll have more information to share with you. And our gala is actually the first Saturday in November. So we are actually working on the theme, and we'll probably have the logos and the save the dates for that coming up soon. So just watch for those. And then November 15th is National Healthy Lunch Day. In correlation with the American Diabetes Month, there will be a lot of different things that we'll be able to put out. Last year, I think we did a lot of different menus and recipes. Right. So, just stay tuned, and we'll continue to put that information out. And of course, being, the month of Thanksgiving too, and a lot of people have food on their mind. So,
That's right.
we're looking for the more healthier options, of course. So, just stay tuned for those. So, really quickly, let's talk about Alert Day. So, March 22nd is Alert Day, and we are very fortunate that we have several different partners that are working with us this year. Carol, can you help
Well,
me?
we have Kroger and Walgreens. PTS Diagnostics is one of our sponsors for
They
Alert
are.
Day this year. They're providing A1C tests for us to use as part of our screening.
That's great. And our screening locations, again, they are on the screen. You'll be able to see them, and you see the timing that we have them. We have Walgreens locations, we have a Walmart location, and a Kroger location. And the Walmart location and the Kroger location, we are fortunate that we have the Women's Wellness on Wheels bus will be at those locations to
Right.
do the testing for us. So
And
we
the
wanna
other
thank them.
locations, right? The other locations will have the Marion County Public Health Department
you.
helping us with the screenings. So they'll do blood glucose testing, but then if you're found to be at a high level, if you're too high for whatever time of day it is, and when you've eaten and all of that, they will determine whether or not they should do an A1C test, and then the A1C test measures 3 months of your blood glucose levels.
Very good.
So yeah, it's a great Alert Day is meant to be that wake up call. If you don't know if you have diabetes, if you're not sure if you're at risk for diabetes, we have a really simple 5-question assessment test that people can take.
Right.
And then if you know you have a family history of diabetes, or maybe you've been told you have pre-diabetes but you haven't been checked, this is another way you can come in and be screened, and we can see where you stand.
Right. And if you do not have the ability to come out and join us that day, you can always do what we were talking about, the risk test online.
Right.
That link is diabetes.org/alertnd. So just stay tuned, and of course tune into our social media. We will have things posted on there throughout the day too, where we are and what's going on, and that is on Facebook and on Twitter, AM Diabetes IN. So just look forward to all of those fun activities coming up.
We need to talk about Channel 6, WRTV.
Oh, definitely. We have down at the bottom the Ask the Experts portion. Again, we are so fortunate to have some amazing partners, and RTV6 has really been that for us through
for
the
several
years.
Yes.
So from 5 p.m. to 7:30 p.m. during the local news, we will have a call-in show. We say ask the experts. Call in and ask them diabetes questions. So you'll need to tune in to our TV6, and they will have the phone number down on the bottom of the screen.
Right.
And we'll have 6 to 7 experts that will be online to answer your questions. Anything else that I'm missing that
Nope,
day?
I think that covers it.
Pretty exciting stuff.
It's a busy
It's
day.
really busy. It's a really busy day. So again, there's all of our social media. Please like us, follow us. We are constantly posting information about our local events and programming too.
Yes.
So
And we'd love to hear from you. So there are many ways that you can get in contact with us. Send us your questions for future shows. If you have ideas for future shows, please contact us.
right, if you have questions, what do you need to know? We're here to give you the answers and help you along this road.
That's right.
All right. Well, I think we're gonna go to a commercial break really quickly, and then come right back.
When Margaret and I decided to sell the old estate here, we had only street sign, conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side. Margaret, only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
I like to follow rules.
Hello, welcome back, everyone. We have with us a very special guest today, Dr. Sarah Hurd. Dr. Hurd, tell us a little bit about yourself and what you do.
I am a periodontist,
A
and so
periodontist.
I graduated from the Indiana University School of Dentistry in 2007. And I come from a family of dentists.
Okay.
So my dad is a dentist and my grandpa was an oral surgeon. And so I always went to school thinking I would be a dentist, like my dad, but I always really liked the surgical classes, like my grandpa.
Okay.
So I decided to stay and specialize for an additional 3 years after dental school
Oh,
to be able to treat periodontal disease exclusively.
I didn't realize there was such a long extra time of education.
Yeah, it's 3 years to be specialized in the treatment and diagnosis of periodontal disease as well as placement of dental implants if necessary.
Okay. So tell us what a periodontist is and what you
periodontist-
treat.
Yeah, periodontist treats gum disease. So we specialize in the diagnosis and treatment of gum disease and again, place dental implants. And gum disease can range from mild, which is more of a gingivitis, which everyone has, to more severe, which
Okay.
affects a significant proportion of the population.
Okay. So what starts periodontal disease?
So periodontal disease is caused by bacteria, and so everyone has bacteria in their mouth, and as soon as you eat anything, it forms plaque, which is a sticky substance that you feel that you know you need to brush off. And if you brush it off or remove it, that's great, but if not, it can start to interact with the tissue in your mouth.
Okay.
The first signs of any problem in the mouth would be gingivitis, which maybe when you brush your teeth, you might notice some bleeding. You may notice that your teeth are moving, but gingivitis typically is easily treated, and often the concern is just that you need to brush and floss more, which can also be a little condescending to patients who have more severe problems
Right.
and need a little bit more. There is a cuff of tissue, like a turtleneck, that goes around each and every tooth.
So we have a picture right here.
Yeah.
Is this kind of what you're talking about?
Yeah, so
Okay.
there's a you can think of the pink tissue across the teeth, and that forms a cuff, not a seal, but a
Thank you.
cuff around the tissue, exactly. And in health, when we probe it, and when you go to a dentist, they should be doing these measurements around your teeth. In health, that tissue can probe up to 3 millimeters. And so the significance of 3 millimeters is that is the deepest you could ever clean by yourself with a toothbrush or floss or mouth rinse. Even if you get an expensive toothbrush, you can only go so far. So what happens when the plaque sits along the gum line is that the tissue becomes a little puffier. And then if you had a 3 millimeter cuff of tissue and it was puffier and maybe a 4, then no matter what you do, you can't get below the tissue.
Okay.
So if you have a more aggressive bacteria that can then hide underneath that pocket and sit along the level of the bone, it can start to interact with the bone. So again, you have to have bacteria, and then your body's response to the bacteria is what actually starts to damage the bone if there is more aggressive bacteria.
So when I'm sitting in the dental chair and they're doing their probe and they're counting out 1, 2, 1, 2, 1, 1, 1, 3.
Yeah,
Yeah. Okay.
There's
That's
really-
what they're doing.
exactly. And there's
Okay.
really no difference between 1, 2s, and 3s, and I don't get to see many of those in
Okay.
my office. So the concern is when you start having pocket depths of 4.
Okay.
And so you can have pocket depths of 4 and not see bone loss, or you can have pocket depths of 4 where you are starting to see some changes in the bone. So again, when you start having the deeper pockets, you're going to need professional help to get underneath that tissue and clean it out. And so the problem is that we have bacteria underneath the tissue that creates inflammation. And we know, especially with our diabetic patients who can't heal as well, that we tend to see a strong link between diabetes and periodontal
Okay.
disease.
So that's going to bring me to my next question then. Is it important that someone with diabetes tell their dentist or hygienist that they have diabetes?
Well, of course, because then we can follow them and monitor them. In my own practice, a lot of my patients that don't respond as they should to normal cleanings or to the deeper cleanings that we do, we often find out later that they do have diabetes. The other thing is that the mouth is one of the first places where you can start to see some of the changes that are on here, and especially if you're having something not heal, your dentist or hygienist may ask if you have diabetes. We also have patients that we follow every 3 months for care, and we find that if something's changed in their mouth, we may ask what their status is, and there's a strong link between the HbA1c that you talked about
Right.
and what's going on in the mouth.
Okay. Well, in addition to gum disease, or is there anything more that you want to talk about on this picture that we have showing right here? I think
Sure,
it'll
so
come up
this
here
is-
in just a minute.
Yeah, this is a slide that talks about the periodontal disease is often a silent disease, and you may not know that you have it.
It's like
Um,
type 2 diabetes.
Exactly
can be
like
very silent.
diabetes. So your concerns would be if you start noticing changes in your gums or in your mouth that concern you might want to have it looked at. Some of the common signs of periodontal disease would be red, tender, swollen gums. You may notice bleeding when you brush or
What we
when you
show
floss. Yeah, you can see how that tissue's a little bit puffy. Bleeding when you brush or floss is a really good indicator that something's going on in the tissue, and your gums should not bleed or when you brush or floss. So it's not okay that they do. And if you notice bleeding, especially on flossing, then you want to floss more often. So people tend to not floss very often.
Right.
So
My dentist has me use these little brushes,
Brushes?
that
Sure.
go between my teeth.
yeah, and those are great, and things that are easier to use we often recommend as well. So there are a lot of instruments and types of things that you can use between the teeth, including water picks. There are a lot of different modalities.
And I think it's one of those things that once you finally get in the habit of that and you realize how much better your mouth feels, then it gives you that incentive to keep doing that every day.
Yeah, and I always tell my patients they would never take a shower and not wash their armpits.
Right.
So we need to do something
That's a good
in those
analogy.
areas.
Good analogy.
So I encourage flossing in the shower or in your car. That's my favorite place.
Oh, okay, there we go. So what other kind of oral health problems do people need to be concerned about?
Well, so diabetes affects the way that you heal. The increase in blood sugar affects how well you can deal with inflammation, and when you have higher blood sugars, then it creates more inflammation. So it's rather cyclic. So in any situation where you aren't going to heal well, you may notice mouth sores, you may notice other fungal infections that can take hold. Often, a lot of times, our patients with diabetes take many medications, and the more medications you take, the higher risk you have for dry mouth. So if you notice dry mouth symptoms, there are mouth rinses you can use for that. There are more medications you can take to try to help control some of those symptoms. But if you have diabetes and then you have a dry mouth, then you're also at increased risk for more dental disease and more cavities. So there are a lot of things that go along with it. Mostly if you're diabetic, though, you are more susceptible to periodontal disease.
Okay. All right. Well, we are getting ready to take a commercial break, and we will come back and discuss this a little further. I have some more questions for you, and then we'll find out where you can find a periodontist.
Okay.
All right. We'll be right back.
You know, when Margaret and I decided to sell the old estate here, we had only one choice in signage. Logan Street Signs and Banners. Conveniently not located on Logan Street anymore. Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore. You know, when Margaret and I...
Welcome back. We hope you enjoyed the always fun commercial breaks that we have here on this channel. And we have Dr. Sarah Hurd with us, who is talking to us about periodontal disease, oral health, and the link with diabetes. There's such a strong connection, and there are a lot of people who are not aware of that. So that's our point today, is to bring this education home to you. So we've got a chart right here that talks about half of American adults suffer from gum disease.
Yeah, the estimates that I've read are that 80% of people will have at least gingivitis, but I would suspect that that's even higher. There are always inflammatory cells in the mouth, so even in someone healthy, they could see gingivitis. This slide in specific talks about that half of Americans will have some sort of bone loss associated. So that's what they're talking about with the gum disease in this situation.
Okay.
Typically we see a little bit of higher prevalence in men, but we suspect maybe because they don't go to the dentist as often.
Right.
And I am, as a periodontist, I know that I'm the least favorite dentist, and so no one really wants to come and see me. But I always tell my patients to think about their teeth like houses, and that I work in the basement. So I want to make sure that they have a strong foundation. So it's important to be sure to follow up with dental care.
So how does periodontal disease affect the bones in our...
Well, what happens is there's that bacteria that sits underneath the tissue, and your body's response to the bacteria will actually create deterioration in the bone.
Okay.
And the bone will just slide down away from the bacteria. That's on that one slide. Yeah, you can kind of, or the other one even, you can kind of see from the...
Look at this picture. This picture.
That
There
one,
we
yeah.
go. Okay.
On the left side, it shows a tooth in health, and on the right side, it shows how the bone has kind of just started to go down.
Right.
And so what happens is there's more tissue in that area, which is the deeper pocket, and then you can only take care of the top of that tooth. What happens though to the plaque is the plaque will harden into calculus or tartar, which is the same word, and it coats the tooth, and so it kind of encases the tooth like a barnacle on a boat. It's very attractive to other things that'll come and stick there, so it kind of just creates this situation where you're going to get more bacteria and more bone loss, and it'll go for quite some time. So treatment options are often directed at getting rid of these deposits that remain on the teeth. So,
Well, let's talk about some of the treatment options for periodontal disease.
So non-surgical options would be a procedure called scaling and root planing. And scaling is the act of removing the calculus, which is stuck to the teeth. But root planing is really treatment of the root surface. And what happens to the calculus is that it doesn't just sit on the tooth like against a window that you can just wipe off. It actually kind of grows into the root surface. So the root planing procedure, it actually targets the diseased root surface to get it removed. Once we remove the diseased portion or the contaminants there, we can have the tissue reestablish a connection with the root and get a healthy pocket. So at some point, as a periodontist, I don't care so much about what depth you have, so much as it's not bleeding, and I know there's nothing below the tissue. So we can get a lot of resolution of inflammation from non-surgical scaling and root planing.
Okay.
And that works really well for probing depths of about 4 to 6 millimeters. If we see more extensive bone loss, then we would consider surgical options, which frighten people. But there are laser alternatives and less invasive ways to do surgical treatment now that might be helpful to patients.
So how do you help a patient that might have a lot of anxiety about visiting a dentist or visiting your office?
Well, we always start with a new patient exam and just sit down and talk to them. I mean, hopefully once they meet me, they'll realize I'm not quite so frightening. But, once you understand, I think the most frightening thing is just not understanding what's going on. And just as diabetes has no cure, there is no cure for periodontal disease, but we can control it and we can get it healthy. And there have been studies that show that if we can control your periodontal disease, that'll actually help with your diabetic control. And vice versa. So the two things are really integrated, and so if we can get you as healthy as we can, it'll help your diabetes as well.
Okay, very interesting. So about what age might somebody start to see the signs of gum disease?
Well, you can see it in children, especially teenage boys, especially people with braces. You'll always see inflammation. You can see gingivitis and red tissue. If you know you have risk factors, even as a child, if you're diabetic, that would be an indication to be sure to monitor these things. The American Association of Periodontology recommends a comprehensive periodontal evaluation once a year. In children, I think it's more just monitoring and making sure that nothing's changing.
Okay. So
There
it's
are-
important to watch
Yeah.
from little child all the way up.
Yeah,
then.
and there are other risk factors for periodontal disease. Diabetes is up there, smoking creates an increased risk. Certain medications can increase your
What
risk.
types of medications?
Medications that people would take for not necessarily related to diabetes. So hypertensive medications,
Okay.
people with high blood pressure. There are medications for cyclosporins, and there's medications for people who are epileptic. So certain kinds of medications will make the tissue grow bigger. And so if
Okay.
the tissue's growing bigger, then you have deeper pockets.
Right.
And then you have a place for bacteria to hide because you can't clean it. And then it can cause problems.
Do you have certain recommendations for a certain type of toothbrush or something like that?
I would recommend a soft toothbrush or an electric toothbrush, but let the toothbrush work for you. If you brush too hard, you can remove the tissue, and I can put it back, but that's surgery.
Right.
No one wants it.
Yeah.
So soft toothbrush is all you need to remove the plaque. Once that plaque has hardened on the tooth, which can take several days, that's when calculus forms, then you can't get it off no matter what you do. So
I
then
know.
you would need a professional cleaning.
I know I've had a lot of great results with the electric toothbrush.
Mhm.
It's just really helped. And my dentist has told me, don't focus so much on brushing your teeth, brush your gums.
Yeah.
And then you get your teeth. And I
Mhm.
had never heard that
Mhm.
described that way before.
Yeah, when you think of that cuff of tissue along the gum line is really where you want to focus if you want to try to sweep out any debris that's in that cuff that you can take care of. And even if you have deeper pockets, the more that you take care of the top of the tooth, the less stuff that goes underneath. So brushing twice a day helps a lot. Flossing or doing something in between the
Uh-huh.
teeth helps, and I would say typically everyone could do more flossing.
All right. Well, so if someone needs to find a periodontist, their dentist could recommend someone.
Yes.
But if someone wants to search on their own, I know this is very difficult to see on the screen, but this is just to illustrate that there are several periodontists in
Yeah.
the area.
Yeah, this is from the Journal of the Indiana Dental Association, and this was our most recent publication. And I believe there are 64 periodontists in the state of Indiana
Okay.
that have done the additional training. Most of us are also board certified, so that helps just to make sure that we retain our knowledge and do additional CE to make sure we're staying on top of things. You could always go to the perio.org.
Okay.
perio.org, and they have a Find the Periodontist section.
Okay.
So typically dentists are more than equipped to help diagnose and treat periodontal disease, but if you have any questions, this list of people would be a helpful place to start as well.
Okay, wonderful. All right, well, I've learned a lot today. Thank you so very much for
Thank
being
you.
with us. We appreciate it. Again, Dr. Sarah Hurd with
The last
us,
slide up has got her contact.
and we will show you Dr. Hurd's contact information. She's on Statesman Drive in Indianapolis, so you must be close to the Castleton area, judged by your zip code.
I am.
Same zip code as the ADA office, so. And your email, drhurd@perio-indy.com.
Yes, yes.
All right. So thank you again.
Thank you very much.
So we done?
Yes.